Respiration happens in the lungs. The trachea is used to transport oxygen to the lungs and to transport carbon dioxide away from the lungs. The ability to inhale and exhale comes from the respiratory diaphragm. A relaxed diaphragm makes the shape of an arch, allowing for volume to increase and pressure to decrease. A contracted diaphragm sits almost flat, decreasing volume and increasing pressure. From the trachea, we can see that there is a branching of the right primary bronchus and left primary bronchus. The right and left primary bronchi begin to branch into secondary bronchi and tertiary bronchi, eventually becoming tiny bronchioles. The bronchioles are then connected to alveolar sacs. These alveolar sacs are surrounded by capillaries which allow for the exchange of oxygen and CO2. Respiratory acidosis is an acid-base balance disturbance due to alveolar hypoventilation. Hypoventilation is when there's an abnormally slow rate of breathing which leads to an increase in the partial pressure of CO2 in the blood, also known as hypercapnia. An acidotic state in the body occurs when excess CO2 is converted into hydrogen ions due to respiratory malfunction.
Respiratory acidosis is caused by an overproduction of acid or a buildup of carbon dioxide in the blood that results from poor lung function or depressed breathing. Blood acidity increases when people ingest substances that contain or produce acid or when the lungs do not expel enough carbon dioxide. Tests on blood samples typically show pH below the normal range of 7.35. In this demonstration, the buttermilk represents the blood and the lemon juice represents the carbon dioxide. The glass on the left represents the blood of an individual experiencing respiratory acidosis. The glass on the right represents the blood of a healthy individual. As respiration occurs, there is an influx of oxygen into the alveolar sacs of the lungs and an efflux of CO2 out of the body in a healthy individual. However, in an unhealthy individual, there is an accumulation of CO2 in the blood, which dissociates into hydrogen ions, leading to an acidotic state of the body. The lemon juice representing the CO2 is poured into both glasses. In a healthy individual, the CO2 is neutralized by bicarbonate. However, in an individual experiencing respiratory acidosis, the CO2 to bicarbonate ratio is increased and the CO2 cannot be neutralized, decreasing the blood pH. This is observed by the accumulation of lemon juice in the unhealthy blood.
Some symptoms of this condition include headache, anxiety, blurred vision, restlessness, and confusion.
There are two forms of acidosis, the first being acute. Acute respiratory acidosis presents itself when an abrupt failure of ventilation occurs. This failure in ventilation may result from depression of the central respiratory center by one or another of the following causes: central nervous system disease or drug-induced respiratory depression, the inability to ventilate adequately due to a neuromuscular disease or paralysis, airway obstruction, usually related to asthma or chronic obstructive pulmonary disease.
Chronic respiratory acidosis may be secondary to many disorders, including COPD. Hypoventilation in COPD involves multiple mechanisms, including the following causes: decreased responsiveness to hypoxia and hypercapnia, increased ventilation perfusion mismatch leading to increased dead space ventilation, and decreased diaphragmatic function due to fatigue and hyperinflation. Chronic respiratory acidosis also may be secondary to obesity hyperventilation syndrome, neuromuscular disorders, and severe restrictive ventilatory defects as such are observed in interstitial fibrosis and thoracic skeletal deformities. Treatment for respiratory acidosis aims at improving the function of the lungs. Drugs that open the airways, like bronchodilators such as albuterol, may help people who have lung diseases such as asthma and emphysema. People who have severely impaired breathing or lung function for whatever reason may need mechanical ventilation to aid breathing. Severe acidosis may also be treated directly when it does not respond to the efforts to treat the cause. In such cases, bicarbonate may be given intravenously. However, bicarbonate provides only temporary relief and may even cause harm, for instance by overloading the body with sodium and water.